This meeting's being recorded. If anybody else is recording the meeting, they need to let us know now. Okay, thank you. Hi, Doug. I'm going to read the required opening statement. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found on the Office of the Attorney General's webpage. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting. Pursuant to Mass General Law, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format and shall contain the date, time, and place of the meeting and a listing of topics that the chair reasonably anticipates will be discussed at the meeting. Okay, that being done, did everybody get a chance to look at Jessica's wonderful minutes?
No, could I say something?
Sure.
On Thursdays, okay, so I leave the house right after 6. I don't get home till close to 5:30 or after. So I don't get to see the minutes if they're submitted Wednesday night or Thursday day or whenever. So no, I did not get to read them.
Okay, so I'll take a motion to table the minutes till our next meeting.
Well, I did read them, so there was nothing wrong with them, Sue, so I'm fine with them.
All right,
Did you read them, Jerry?
You and Jerry can vote.
Okay, I read them. Just needed to move a comma. That's all. Everything looks fine. I'll get a
So
motion.
I'll make a motion. I'll make a
ahead.
motion to accept the minutes.
Second, all in favor? Jean?
Jean Nielsen, aye.
Jerry, aye. Okay, move on. So public comment for 10 minutes at the chair's discretion. Peter, you have anything you'd like to discuss with us?
Not at this time, no.
Dennis Hackett, is that correct? Can we unmute Dennis?
Yeah, I don't have anything to say.
Welcome, Dennis, by the way. And Dougie?
I'm good right now. Thank you.
Oh, okay.
Do we have Dennis's address and everything to put in our guest book, which we don't have?
Tammy,
sorry?
you're muted. Tammy, you're muted.
Kate just commented that Dennis is from the reminder.
Oh,
Oh.
okay, got Dennis.
Okay, so thank you, Kate. Where is Kate? Oh, there you are, Dr. Johnson.
I'm
I can't
here.
see you. Hello.
I'm just taking some snacks.
Okay. Okay. So
That's what I was doing.
We're done with public comment at this time. Health Director's report.
Well, I'd like to report that I had a lovely winter break off last.
Yes, I was just going to ask you. I'm sorry. Pardon.
It was
Yay,
nice.
Tammy.
I'm sorry.
Yay, Tammy.
Yeah.
Deserved it.
It was nice. While I attended quite a few meetings and things like that throughout the week, it was just nice to be at home, and we drank lots of hot cocoa and played in the snow. But this week's it's been pretty busy this week. I'm already on my fourth perk test today of the week. So I did 3 Noble Steed Crossing, which was a new property, 4 Noble Steed Crossing, which is new property, 39 Fernwood, which was a repair, and 373 Granville Road, which is a repair. And I've got some lined up for tomorrow too.
Hey, is the ground, how far down is the ground frozen?
6 inches, maybe. Way less than a foot. Actually, right now it was veritable mud today. It was definitely not. Our weather in New England is not the way it used to be. The ground doesn't freeze, and I am made of hardy stock. If you give me some wool socks, I do not mind being out there for 5 hours.
You complained about your feet being cold today in the
I
office,
did to
Tammy.
you, but I did not while I was working, Jean.
Okay, move on.
Quite a few quite a few plans this week and last week, but have not quite finished all of them yet, so I'll put them in next week's notes. But I think at least 5 of them were new systems, which is good to look at. Lots of different trainings and everything. Yesterday,
Tammy, can you mention the lots that you approved, the plans that you approved?
I didn't approve any yet, so
Okay.
they don't have my signature. So I'll put them on
Next week,
next week's.
4th.
Most of them were at the Greens.
Okay.
3 or 4 of them were at the Greens, I believe.
Okay.
But that'll go on next. They'll be approved by next week.
Okay.
Approved tomorrow, so they'll
What
be on next week's
The
note.
soils like there, are they 2 minute per inch? The soil
Where
At the greens. Are they 2 minute per inch?
they're all right. They're all right with about a half hour an inch. They're not fast. They're not slow. They're just kind of right in the middle. A lot different than when you get closer to College Highway. Then it gets a little bit sandier, but that spot's a little wet, a little more wet.
Where's the groundwater?
Fast.
Where's the ground?
It's funny. One side's pretty high, so there's going to be a lot of mounded systems on one side, and then the other side is pretty low. Not low, but it'll still be level. So it'll be a little different. But once they get through grading and then the landscaping afterwards, it'll look great.
Who is doing them?
That's true.
Most of them. Wait, who, the perk tests or the
PRS,
construction?
the engineer. Either the PE.
The
or
engineer. So there's a little bit of soil evaluation by Randy White, a little bit by Levesque, a little bit by Barry Searle, and some older ones by Dennis LaCourse that we've gone through. So a couple, it kind of depends on who's available. They'll use different people over there. And some of the lots, I think, are being constructed by different people, but it seems like mostly the ones on the east side are more Crestview. So, or with Hamlin construction. And let's see. So this week was the first half of the MHOA's Department of Environmental Protection webinar. That was yesterday. And they covered PFAS in drinking water, lead and copper testing, and dealing with noise complaints in your community. Every Tuesday and Friday, I've been on the interagency conference calls with the state regarding COVID. Today, there was a really interesting webinar this afternoon with the National Association for City and County Health Officials called the COVID-19 Vaccination Stories from the Field, Local Health Departments and Pharmacy Partnerships. I was kind of hoping to get some more information about partnering with pharmacies, but it looks like that's going on more in other states than that is
Did you laugh?
Massachusetts, it seems. But it was interesting nonetheless. That was 4 days of non-COVID work. So yesterday, at the end of the day, the local health departments received an email from the state saying that this morning at 9 there would be an update, an announcement conference call with the governor or with the Department of Public Health. And so they announced at least several hours in advance of the notice that on March 1st, we will be moving to phase 3, step 2 of the reopening plan. And, let me just quickly, so this is moving on to COVID. Let me just quickly share my screen because they put up the PowerPoint. Okay. So this was the announcement. So that went out at 1 today to the community. So first was that March 1st, we're effectively going back to phase 3, step 2, and that if all things look well, on March 22nd, we'll be going to phase 4, step 1, which will include some gathering limit increases.
So what's phase 3, step 2 consist of? Oh, you're going to tell me right now. Thank you.
Phase 3, step 2, all of the capacity limits or the sectors with capacity limits will be back up at 50%, which will be concert halls, theaters, indoor performance spaces, indoor recreational activities, such as skating, obstacle courses. A lot of that stuff doesn't really affect Southwick. Basically all the rest of here. So our personal close contacts, which would be massage and hairdressing, nails, is back up to 50%. Fitness centers, libraries, places of worship, office spaces. One of the things too that they really did press in here, that this is a 50%, this doesn't include employees. So office spaces like the town hall, the 50% capacity wouldn't say be the Board of Health office right now because we don't let the public in. So there wouldn't be, we wouldn't be reducing in those offices. I mean,
So
we
are
would
we-
be
are
keeping
we
with,
not- I'm sorry.
oh, no, we would still be keeping with, you know, social distancing and things like that, but that's not where that applies in office spaces.
So are we going to open up town hall?
No.
Okay.
So the restaurants are back to utilizing the social distancing as their sort of capacity limit and not as an actual number or percentage. So we're back to where we were before, making sure the tables are 6 feet apart or there is a 6 foot high barrier in between them. They're staying at 6 people per table. We're not going back to 10 yet. Musical performances will be allowed, but no singing. And they're still staying at 90-minute time limit for the tables, and places with food courts, which isn't really us, remain closed. Fitting rooms. And then this is the part that's subject to public health data. And I got to be honest, I don't know. I can't imagine that the public health data will be that much better in 3 weeks that we really want to start having these events. So event venue and public settings, 100 indoor and 150 outdoor. And then at private homes, we're going back to 10 indoors, 25 outdoors, or staying at 10 indoors, 25 outdoors. And then so large capacity stadiums will be allowed to open with a 12% capacity limit. So this is something that we will have to take in account as the spring rolls out with motocross, because now we actually have a number that we could utilize and not just social distancing and whatnot. They are putting a number. And so 12% of 5,000 is 600. If anyone wants to know. Let's see. And that anybody is considered a large venue has to submit not just a safety plan to us, but to the Department of Public Health. Overnight camps will be allowed for the summer, which will be great for wilderness adventures. Exhibition halls and dancing is only allowed at weddings and events. So if you were having music, just say at like Walk on Water, dancing is not allowed. But if that was a wedding or Jack and Jill or something like that, it would be allowed. And that is that. Does anyone want to look back at any of this before I close out?
Jean, Sue,
Let's
Okay.
just look back to the Monday one again.
Say that again.
We look back to the Monday. Let's go on Monday.
Okay, so this is Monday. So this is probably the better one. So all these will go from 40% to 50%.
Okay.
Not too much of a change on Monday. The biggest change is that the restaurants can go back to the social distancing aspect of using capacity limit. Which will definitely help some of our really, our tight businesses. to be able to put that back.
Okay,
This is good?
yep, 50%.
There you go.
Hey, Joe.
That is kind of the big, oh, no, not all the biggest news. So last week on Wednesday, the governor announced that they are streamlining the vaccine distribution program. And that would mean that local municipalities will not be able to request their own vaccine. So I believe it was Friday, Doug, that you met with the mayors of Agawam and Westfield about the regional. Was that Friday?
I wouldn't characterize it as a meeting. Mayor Sapelli called me at home and said,
Oh, sorry.
"We're doing this. Are you in?" I'm like, "Yeah, we're in. Just tell me what you need and how much to write the check for. We'll get it from Joe, and and we got a couple of EpiPens to kick in. We're in. Let's go."
Yeah.
So my question, Doug, is this something that the select board decides, or does it come to the Board of Health? Not to step on anybody's toes.
Well, we reached out over the weekend. We reached out to the health agent to make sure that to let her know, to relay the conversation that happened. And then we brought it up on Monday during the select board meeting that if we needed financial support, that we would support it. But since it was going to be run out of, actually it's West Springfield is actually spearheading it, and Agawam and we're, Southwick and a couple other communities are trying to join in to make it a much more regional approach. There wasn't really a commitment to be made other than, half joking with Mayor Sapelli, but as far as if they were able to kick it off, then it would be a much more formal thing as to what we were going to do, whether we needed to bring our own, the town would be committing resources outside the Board of Health, like medics, like the ambulance, like others like that. So that's
Can
how
I-
we left it.
Could someone explain to me what it's all about? I had 2 techs at work ask me about it, and I kind of felt a little stupid because I had no idea what was going on because no one informed the Board of Health. So can someone tell me what this is all about?
Short story
Yeah.
is Mayor of West Springfield. I'm sorry, Tammy. Short story is
No,
Mayor of
you
West
know it better than
Springfield.
me.
Mayor of West Springfield recruited Velas and Boldiga and everybody else to say this East Springfield thing doesn't work for anybody. It's very arduous for people on the other side of the river to get to East Springfield. And the Big E is an opportune site for people west. And would the state consider to set up a vaccine site or allow West Springfield and partners to set up a vaccine site at the Big E location to facilitate people west of the river? Just by way of conversation, Tammy had been having a weekly call with a lot of stakeholders from town as far as setting up a municipal clinic in Southwick. And then the state basically pulled out the rug from under the planning and said, you can't have any vaccine. So it left us in a bad way. And we were actually, the subsequent calls we were having were, okay, how can we rent a van or vans or buses and get some of our senior population, especially out to East Springfield to their appointments to get their shots? And just the time of it, it's an hour to get out there. And then you've got the time in line and the time for the shot and the time for waiting and an hour back. We would have no throughput, right? Just, we would be ineffectual in getting people in and out of there. So if you did that at the Big E, you cut that travel time way down, and people can actually get there even on their own easier than traveling to East Springfield. So it seemed to me like it was a reasonable request from the mayor for us to join in. So we did it. So if I didn't see, frankly, I didn't think about it. I apologize if I feel I overstepped, but I went to Carl and asked him. I said, this is what happened. This is the phone call I had. It was literally a 2-minute call. And I said, okay, we're in. And other than that, what else are we to do at this point until it happens? And then, the rest of the emails went from there. And then the Board of Selectmen voted to support it in theory on Monday. But the governor hasn't, they basically pushed back and said it's too close to the existing site for now. And if I can, just for 1 second, I did watch the governor's presser today, and there's a lot of pushback, and I get it. But the problem is a scarcity issue. So it has nothing to do with the scheduling software or anything like that. There are just more people than vaccine. So with them, and we said this when we were having our meetings, and I said it during the calls we were having with Tammy. The more they spread out the vaccine, that everybody and their brother wants to give it out, the less places you're actually going to be able to get it, because it's just, there's too few. You know, and we had been talking, everybody and their brother was going to do the vaccine, from Peter Pan to Chabeli's Mobile. I don't know. It seemed like everywhere you turned around, someone wanted to jab you in the arm, but they would each get 2 shots a week based on the amount of vaccine that's coming into the state. So I get why they're centralizing it. And he spoke very fervently this afternoon on the same topic, in that, okay, we get that there's 4 million people that are eligible to be vaccinated, or whatever that number is, and we get 160,000 shots. So yeah, we get it. When you go on the site, it says your number 62,000 in line for the 160, you know, this many appointments we have today, you're not going to get it. And so until they get more vaccine, even having another place to get it at the Big E is going to be ineffectual. But
So that's out? Is that what
not
the
yet.
state said?
No, not yet. But if Moderna and Pfizer are stepping up their game as far as the amount of vaccine they're producing, Johnson Johnson's coming, AstraZeneca is going to apply any minute for emergency use order, you're going to have more vaccine. At some point, you're going to get to the point where you're going to have enough vaccine to support additional outlets of supply, so that you can actually administer more shots, and you could ramp up Big E to give out 1,000 of these a day or 2,000 a day. Right now, they couldn't even give them any vaccine, so it doesn't matter what their capacity is. They don't have the shots to do it. But once they get to that point, then you could ramp in a Big E and take care of people west of the river easier than going to East Springfield. I mean, Joe, you know, you've been to east of the river. It's a pain in the ass to get there for the clinic, you know?
The
So my
Big E, the Big E has no problem with a site there?
No, they got the transportation center. They have a good experience getting, you know, 1 million people in and out of there in a day.
And the surrounding towns would foot the bill for security there and parking cars and all that?
Wait, it's not going to be a big parking problem, just like the mall, right? It's you don't charge for parking. It's and the Big E site's available. They'll make it available, and then it's going to be up to the towns that are going to participate at some level to support it, right? Whether we need to supply the medics for some of the capacity to administer the shots, if we can supply a medic and an ambulance to watch, that kind of stuff. So, and I was joking about the EpiPens only because I know we talked about it and we bought them and now we don't need them and they have an expiration date, so we'll bring them, right? So, but you know, that's just part and parcel of it. It's not inexpensive to set up a clinic, right? But you know, if it's something that is going to be beneficial and get throughput and get people from Southwick, Agawam, West Springfield, and wherever vaccinated, we'll do it. You know, we would support it.
Agreed.
Okay, so
Agreed.
my question to my board is that something that we should have been in on? Or should we just have read it in the paper and get it? I think it's a great idea. I think it's wonderful. But either we're in it or we're not. So what do you think, Sue?
Well, I think it's a great idea. I just wish I knew about it ahead of time before
How
I.
about you, Gene?
Same here.
Okay, so Doug,
I take utter and full responsibility for that.
are you
so
running this year?
Apparently, I don't care, right?
know.
We've talked about this, you know, it's irrelevant. We've talked about this before as far as, you know, we've already been, you know, from the Board of Selectmen has been very committal when it came time to bring resources to bear, whether it's to support a
Right.
clinic in town or out of town. Frankly, I didn't really think it through that far as saying, okay, if it's going to be in West Springfield, at what point does our Board of Health have a standing other than our health agent? And granted, it's a very important part. And I said, I missed it. You know, our health agent is going to be intrinsic to try to helping with whatever resources we need to bring to bear to do that. Right.
So-
Because she's done all that research.
Right, so my
And honestly,
suggestion,
can I-
my suggestion would have been, okay, we're in, but I want to talk to my Board of Health and see what they think.
Sure.
And I'm sure, and every one of us, the three of us, I won't speak for Sue and Jean, but I certainly would have supported it, but I wish you would, like Sue said, I wish you would have heard about it before we read it in the paper.
Okay.
Okay.
You've got my
honestly,
vote
Jerry-
for selectman.
Heard
I'm
from-
No, I'm
gonna,
not
I'm
running.
gonna add in, it seemed very, very quick in
Oh, it
terms
jumped
of
off.
one day, they're saying, sending your survey, how many doses do you want? And literally 3 days later, they're saying, nope, we have 20 sites across the state, stop requesting vaccine. There was no time to kind of undo the planning because the state, they made the change on us. That was the issue. We wanted desperately to get as many doses as we could for Council of Aging and in affordable housing. And they basically shut us down. And then went into these 20 cities where the highest risk and equity were.
So
So,
I agree. I'm
We
sorry,
didn't
Kate.
have any leeway to that.
I understand that, and it's the typical, our money flows east and what comes west, past 495. So I think that's the predicament that our towns face west of Worcester. That they look at the numbers and they say, okay, Southwick can wait. And
I
that's what
agree.
do.
And if you're looking at an equity issue, we have just as many vulnerable people in Hampden, Frankly, and the Berkshires than there are in Boston. It's a volume issue.
Yes,
It's
okay.
not a non-equity issue because we should be serving people equally across the state, and that's not happening now that they've changed that.
So Tammy, if you get a chance, in one of your next you can relay to the Department of Public Health that we're not happy campers. I mean, I don't know if that'll make a difference to anybody,
I think they already have.
but they need
There,
to hear it every
there is
time.
definitely not a lot of happy campers at the meetings.
Yeah, they shouldn't be.
It's-
I mean, I understand that the vaccine is in short supply. But again, I'll reiterate again, they've had months and months and months to plan these clinics, vaccines, get people lined up. And the excuse that they didn't know how many vaccines they were getting is ludicrous. They make us do these emergency dispensing sites every year. And we do them every year and they throw them out the window.
Yep, we're not even using that model.
I understand.
The
but-
people that would assist us and support us in that program, which was called Public Health Emergency Planning, they are not even being utilized. So that was our sort of our lifeline to emergency preparedness for God knows how many years, and the model that we used. So, we're all sort of floating, just in nothing and with no real connection to people that we know at the state. And it is unfortunate, especially since we had this model that we utilized for all these years and we're not using it. And we're not
Okay.
utilizing the people that
Right.
helped us all along.
And I would also add the resources in terms of technology and learning and purchases and trying to think that we could do a service at the local level. I mean, maybe we can use those in another venue. I hate to see those go to waste, but we did a lot of procurement in terms of PPE and signage and, what I thought was going to be a win-win. But it is what it is. I'm just completely disappointed that it did get taken away from us.
But there'll still be some opportunities. So there's still kind of they're hashing out the finer points of the getting vaccine to homebound residents,
Mhm.
and that's something that they were looking to the local boards of health to work on. We still don't have that much information about it yet, but they're working on that.
Sue, you have
Want
any
us to
comments?
continue to work with the
I'm sorry, Stanley.
senior housing also. But I don't think that they've gotten too much way with the pharmacies, right, Kate? The senior-
No. The pharmacies are not being very cooperative, I must say,
Well,
from the
how are-
feedback that I'm
How are they
hearing.
supposed to, if you go into Walgreens, I mean, how are they supposed to line 50 people up and have one of their pharmacists or somebody from MRC start giving vaccinations and have people wait 15 or 20 minutes.
Make
I mean, you're not
appointments.
set up for
Yeah,
it.
they're not vaccinating for sure. I mean, Stop and Shop is, I believe, I'm not even, so Walgreens in
has some
Southwick is
spots,
not,
too.
I don't think CVS in Southwick is.
No.
Stop and Shop, maybe, I haven't been there to, check out how they're doing that plan, that model, but I'm
Big Y has-
not sure.
Big Y has 2 spots set up. One in East Long Meadow.
Yep.
And the other one, I don't know where it is, but maybe Greenfield, but that's it. So, okay. Sue, you have any comments till we move on?
Yeah, I just, I haven't done much research on the Pfizer. No, I haven't done much research on the Johnson or the AstraZeneca.
Mhm.
Does anybody know the effectiveness of that, of those two?
Well, what I'm
The
hearing,
only,
Tammy, I'm sorry.
Oh,
No,
I
it's-
think no.
it's Kate. I haven't heard anything on AstraZeneca. I've heard initially the Johnson & Johnson was 87%, but that was like a couple weeks ago. So I don't know if that's changed or not. Excuse me.
Yeah,
I
originally
just wish
Johnson
we-
and Johnson was set at 72%,
Okay.
but they raised it, and what the J&J thing did, obviously, it was one shot. And
Mhm.
during the trials, it kept people out of the hospital and off of ventilators, which is, I mean,
Huge.
if it's 28% people that will get it, at least they'll recover at home and they won't have to go to the hospital, won't get on a ventilator. That's what the J&J did.
I guess it's better than nothing, but I wish we would either get the Moderna or the Pfizer,
Well, of course,
if we ever get it.
I don't,
We asked for Moderna.
Yeah.
Jeannie, you all set with this?
Jean,
Yes, I am. I was
Okay.
just unmuting myself.
Tammy, you have anything to add to this conversation about this?
Not yet. Everything is really just up in the air. I've been talking to some of my local health directors, and we all sort of feel exactly the same way. Like we were just kind of,
So we get
It goes up and it goes
130,000 a
down.
week?
What?
We get 130,000 a week. Is that right? Is that our number now, Kate, Tammy?
Oh, I don't know.
He said 160 during the presser.
60,000 a week?
160?
A day, I mean.
160.
160.
One-
For the state.
160.
Yeah, that's the number I heard.
And we already vaccinated 1 million, is that correct?
Yeah, over 1 million.
So at least 5 million to go.
Yeah, 1.5. Is that right?
And
Yeah,
according to his number, we're number 1 out of states with population greater than 5 million, and we're in the top 10 overall.
okay.
hey, do we know how many people have been vaccinated who live in Southwick? Do we get that record, that data?
They don't go that granular, unfortunately. I wish I knew that. I mean, the ones I know, it's probably a handful, but they don't go to that level. Not at this
Okay,
time.
now that you're on, what do
Yeah.
our numbers look like this week?
Okay,
Oh,
so,
let me share your screen.
Yeah, I didn't understand that last night, so.
Here you
it's
go.
looking better, people. It's looking better. So being in the yellow is good. Okay. The total cases, again, we've had this conversation for months, but the state's reporting 472 total cases. We're actually over 500. Case count is 21, which makes us in the yellow because we're less than 25 for the 2-week period. The total tests, 11,000, which is good. So the percentage that we look at, 2.98, kind of to the right. And we haven't been that low since mid-November. So, and again, looking at Hampden County. So we're doing well in comparison. We're lower than Hampden County. And I think all the counties, unless I'm mistaken, all were lower this week. I just want to get my sheet. They were all lower, which is a good sign. So is it, people testing less, vaccine? I'm not sure, but you can see here. I don't know if you can see my cursor, but if you look at the red 820, 888, 865, right? There are people testing more and now people testing less. So is that indicative of, less positive cases? It's hard to tell. So I think there's this, like, kind of this transition from maybe less testing, more vaccine. Not sure. It's hard to tell. It's
What's
really
the
hard to
strain
tell.
look like? When you talk to these people, do you have any hospitalizations or deaths, or is it still
No
just?
hospitalizations. Our last death occurred in January.
And
And just let me give you in terms of age, which I think is important. Between February 1st and the 25th, the age average is 46 years. But for this last reporting period for DPH, it was 50 years. The period before was 46 years, and the period before that is 42. So we're not talking people in their 70s and 80s. We're talking people in their 50s, early 60s that are actually testing positive.
Okay. Any questions, Sue? Jean?
No,
Tammy, Doug? Peter? Are you still there?
Yep, I'm here. No questions.
Okay, Dennis, is that right? Dennis, you have any questions for Kate or us?
No, I'm good.
Okay, Tammy?
Does anybody mind if I close this window?
close it.
Anybody? Go ahead. Okay, Tammy, are you done with your?
That's my report.
Okay, let's bring up some old business, which is the restaurant fees. Sue, have you thought about it, and what do you think?
Well, I had already said 50% across the board for 2022.
Okay, how about you, Jean?
Well, actually, I went over all the numbers. And food service, total revenue was 4,325. Catering, 400. Mobile units, 225. So we're talking under $5,000 here. I also asked Jess, thank you, Jess, for the form itself, and she gave me the list of only 5 restaurants that had a reduction in seating because of capacity. Gristmill, Daily Grind, The Cottages, Tucker's, and Red Riding. So they're the ones that already had received a reduction because of seating capacity. And I looked at the budget that we have under the operations. We're actually 0% in the immunization clinics, which obviously looks like it's going to stay that way until the end of this fiscal year. And we're 0% at minor equipment and a little low on the office supplies. In other words, we're really not spending our operations budget for this year. So what I'm proposing, or I'm opening for discussion to the board members, is at minimum, do not charge for catering and mobile units for next year, the year 2022. They will be 0. And Sue, if you wanted to do a 50% reduction on food service, I personally, or as a Board of Health member, would like to change that to 100%. In other words, have absolutely no fees for any food services permits in the year 2022.
And Jean, why do you think that's?
Why do I think that?
What's the rationale behind that?
The rationale is we're not spending our budget. We really didn't have a significant difference in the seating capacity for the restaurants. And I think, catering 400, mobile units $225. These amounts are not going to break the town of Southwick. And it's a goodwill to show maybe we're getting back on track and maybe let's start off on a good foot.
Sue? So what exactly would you propose to the board?
That we, at minimum, do not charge for catering in mobile units and charge 50% less in the year 2020 for food permits, or 0 for catering, 0 for mobile units, and 0 for food permits.
Sue?
Were mobile units affected that much? Were
We
they?
didn't have as many this year, but I also want to point out that of the mobile units that we did have this year, or probably only one of them was from a business in town. So anytime a mobile unit does come in, I have to do a lot more work than, say, with Mr. Didi's mobile units. I have to do all the background checks and call the towns from where they're in. I do not recommend getting rid of the mobile or the catering, just lowering the prices if that's the case. But it looks like mobile isn't real popular this year. But that didn't mean it wasn't the year before, and it won't be in in 2022.
So Jean, go ahead, Sue.
Go ahead. Well, the mobile units too, if they're not from the town like Joe Didi, they're not paying taxes, right?
You're right, right?
Town and park.
I mean, we still do the background checks for the common victulars, but they usually would come up clean if they're not from town.
So
Okay,
Jean,
catering, how many catering permits, Jean, did we give out?
I did the total. There was a total of 400. Jess, maybe you can answer how many catering permits. I just did the monetary.
There
4?
was 4. Mhm.
Okay, so 4.
And there was,
$100 each.
and was there any catering done last year? Or this, well, there will be some this year.
I don't know. I have what was collected as of January 1st, 2021.
so Sue, what's your bottom number?
What do you mean by bottom number?
Well, how low will you go on the catering and the mobile and the other services?
I wasn't really thinking about catering and mobile units. I was thinking more of restaurants, but with the information Jean just gave me, it's pretty interesting.
Jean, where would you want to go with this?
Yeah, I already said,
Yeah.
I mean, I really don't want any permits at all for the year 2022. Any charge for permits in the year 2022.
Sue, will you go along with that?
No.
Okay, it's got a motion, Jean.
Well, wait a minute.
No, I'm still under the discussion stage.
Oh, okay.
This may go on. This may go on for months.
What may go on for a moment?
Hey, do we have anybody who's interested in running for the Board of Health? Does anybody know of anybody who's interested? Since Jerry will be off in a few months.
Joe, are you
Joe,
in
you wanna
touch with
be
you
what?
guys?
I've already asked. I can't be on both, or I would. I think this
I
is a
know.
great board. I did put some feelers out, just so you know. I reached out to a few doctors in town to see if I could get any kind of, any interest, I should say. I have not heard back, but I'm definitely trying to get them replaced with someone that is good. So that's where I'm at.
Okay, so after May, if you guys want to bring this back up with the third member, you can. But I'm pretty well set with what Jean's thinking, Sue. So.
No fees at all
No
for
fees at all.
how would that like affect, that's for Big Y, for everything?
No,
food.
no, I'm talking restaurants, catering, and mobile units.
Okay, and how many restaurants would that affect? 4, you said, or no, more?
60?
We have
I don't
60,
know, Jess, you got the number?
we have 60 restaurants in town?
It's, you
60.
should, you have the spreadsheet in front of you, Jane, for food service?
No, no, I didn't. I'm sorry, Jess. The only thing I wrote down is the 5 that actually had a reduction in, because of the reduced table sizes that
Oh,
were allowed.
okay, well, I was rushing out of town hall today and I did not
That's
get my
fine.
zip drive, so I can't pull it up for you, but
Okay,
I
I
could
have
get it
it.
to you in the morning.
What about a food service establishment? Food service establishments, that's what we want, right?
Right.
Yeah,
I feel like, yeah, I feel like we do about 2 full sheets of labels, so that's gotta be close to 60.
yeah, but some of those are retail.
But they're retail with food service. And that right now they might not have chairs in them because it's takeout, but,
Okay, I count 30.
Well,
right? Or am I wrong?
well, like mobile and, I don't know, Pride, like all, Big Y. Well, Big Y has chairs too, but
Yeah.
So it's a total of,
Food
Yeah, well,
service.
That's under retail.
they're retail.
So
so
it's like
Jean,
34, but the schools don't pay anyways.
no,
Right.
So therefore there's 1, 2, 3, 4, 5, 6, 7.
I want to say it's around 40, but
I count 31 for
Okay.
food.
but it's, there's probably more now because that was a few weeks ago. So
Jean, you
Okay.
want to
31.
keep talking about this or you want to vote on it?
No, I wanted to bring it up for discussion now that I had the facts, now that I had the data. And
Okay,
this is what, it's going to be a decision of the board, not me.
Okay, there's 38 when you count the mobile units and catering.
okay.
So Tucker's needs a separate catering and a separate,
So catering means that, so in order to cater, you need to have 2 licenses, but you don't necessarily, they don't have to be in the same town. So what that means is that Tucker's can cater,
Anywhere.
Tucker's can have a sit-down establishment here, and Tucker's can cater to anywhere that accepts their catering license from the town of Southwick. So they could go to Westfield and they'd say, you have a catering license, thank you for checking with the Board of Health, depending on how the policies are with those towns.
Each
So
time.
that's not necessarily, that doesn't necessarily mean that they're just gonna cater here, they could also cater elsewhere, is the case.
So
Westfield could charge them also?
Probably not,
Most places don't do it that way.
because
It
then we would
goes
charge
in
their
one
people
direction.
when they came in.
Okay, one direction.
Yeah, it usually
So-
flows in one direction.
All right, well, there's 38 then.
And,
So Doug? Or Joe?
Yeah,
I mean, Joe, I can guess that you have a vested interest in this, so I'll ask Doug. What would be the feeling downstairs if we did this? As a goodwill gesture.
Hey, that's strictly the Board of Health. You don't have to consult the Board of Selectmen on this.
I know.
No,
but
I
also like,
I was trying to get back in your good graces after my
I know.
faux pas this week.
I was,
But I want to say that I do appreciate Jeannie taking the time to
right,
really look at the number, right? So, and yeah, it was ideally, it's a goodwill gesture. We get it. But I think Jeannie's actually taken the time to look at the real dollar amounts and also look at the impact potentially on your budget, if any. So, I mean, whatever you guys decide to do is fine for next year. It really, it's totally within your purview and your discretion. I hear Tammy too saying that there's work involved. And, you know, with the food trucks, I know that, you know, one of the issues we had over this past through the pandemic was with a food truck in one instance. That food truck will not be down for breakfast. It actually burned up in Granby, so it won't be back. But, you know, that could be problematic throughout a pandemic of having those food trucks around too. But I take what Tammy said with, as important. But I just wanted to say I appreciate Jeannie taking the time to run the numbers and look at the impact on your budget. And, coming out of this, if we're, we can get through this and be kind of back to quasi sort of maybe normal-ish July, August, it's just a goodwill gesture to these places that have just been beaten
Sure.
up badly. Not gypped of, their livelihood, some of them, some of them may not be here by the time you guys get around to reducing the fees, but I don't think, $50 or $100 is going to be the thing that puts them out of business
Right.
either. But I think it's just a goodwill gesture from the town. It's like, wait, we hear you, we did all we could for you all along. Tammy and everybody was helping these guys as best they could to, pivot to takeout and give them the rules and the maps and the charts and the signs, right? We did all we could do under the circumstance. And this is just one more piece to say, okay, we're still here for you.
So Red Robin was closed for lunch today, and the launch was closed for lunch.
Well, Robin Hood's closed for the winter. I think she
For
reopened
the winter,
sometime.
to go south.
Yeah, she comes up in a couple of weeks.
Okay.
She'll open up again anyway.
All right. So
But-
Jean, you want to?
Again, this was something, this is data, this is fact, and this is something, I was thinking about. I didn't open it up as a motion. I opened it up as a discussion. And, maybe you're right. Maybe we should hold off a little towards the middle or, July, August, sometime around there. Things may change. But right now, this is my perspective on what I would like.
Were the tanning salons closed down for a period of time?
They were until May.
I saw a sign said free tanning. Is that the one in town? Was that it?
Did it?
Yeah, we have one in town. Hey, La Patisseria, did they get a permit this year?
Jessica?
Nope, not yet.
They haven't.
Are they open?
Yeah.
They
Yeah.
are. I've been in contact with them a few times. They've gotten letters. Letters are going out tomorrow to the few people that haven't submitted an application.
Tammy, you want to down up and take a trip down?
On next Thursday, I will be visiting everybody with the letter for cease and desist if they don't pay. But
Okay.
by Wednesday.
Can I ask a question on this?
Are you gonna give them the letter that shows them what kind of fines they're gonna pay because they haven't paid on time?
Yeah,
Okay,
the letter's already been drafted.
okay,
How
good.
many do we have? How many do we have, Jessica?
7.
7?
4 are not open right now.
Oh, okay.
Fair enough.
Joe, you want to say something?
Yes, Dr. Asia. And I do have an interest in this, I guess, as you say. I probably have the most Board of Health permits for food in this town if we break it down, which is cool. I do enjoy paying it. But just as a word of caution, I wouldn't get rid of it completely, only because, Doc, as you know, the following year they're going to go, oh, was that the year we didn't pay? Right? And now you have 7 that didn't pay. I can just see that snowballing. So if you cut it down to half or 25%, I get it. But if it goes away completely in some of these restaurateurs' minds, it goes away for a few years, whether you want it to or not. So that's all I got to say, and I don't mind. I paid all my permits for this year, whether we use them or not. I get it. So that's it. And I want to know those 7 goddamn restaurants, because that's BS.
Read them off. That's why
Yeah,
we have
what are
these
they?
meetings.
Yeah, let's get it in a
Jessica?
minute.
The
Can I just throw my 2 cents in?
Absolutely, Kate.
I appreciate Jean's, points of discussion.
Yeah.
What I see on my end is I see the businesses that completely closed down, for 14 to 21 days to 28 days for multiple reasons in terms of contact tracing and positive employees. And it's not just restaurants. What are we doing for them?
Well, we can only do what we can do. It's under our purview. So
But I'm saying in terms of licensing, like if it's a hair salon,
We don't license them.
We don't license them.
we don't charge them for anything.
no,
it's
the
not
state-
just
that's the
restaurants.
state.
Department of Cosmetology.
Okay, so only restaurants we're talking about.
We have tanning parlors.
Just what we are allowed to charge under our purview. And so that's what we're talking about, Kate, I think. Is that right, Jean? Sue?
Yeah.
Was Wilderness Experience closed for a while?
They did not have their pool open for quite some time. But they did have, they operated their camp over the summer, and now they're back to one-on-one training in the pool.
I have a question. Funeral homes. We license them, but do we do anything? Do you go and inspect them? I'm just wondering why we license them.
I would if it wasn't a pandemic.
You would?
I'm not
Okay.
I'll be a little morbid here. I kind of like funeral home inspections.
Oh, okay. So we would if it wasn't for the pandemic.
Done doing this.
And the tanning salon too. But Western Mass
Yeah.
Rendering, we license them. Will you be going there?
Well, I did ask them for a tour. But I don't think it was something that was inspected before, and I don't know what the policies. That's not under public health that I know of. It's just the transportation of the transportation and moving from vehicles is really the part that we are.
Jessica, does
love to
Mass
see the
Rendering get a
facility.
permit from us?
Yes, $100. I did do an inspection there many years ago. It was more like a tour.
Okay.
I had talked to the owner. All my years of doing food inspections and seeing their name on the barrels and everything, I was kind of excited to be in Southwick. This is nerdy health agent talk. I'm gonna stop.
Okay.
They had an illegal, just for fun, they had an illegal electronic messaging sign that the building inspector made them take down.
Oh.
Again, not Board of Health purview. Okay, Jessica, can we get back to who those restaurants are, please?
Yes, the Pasticceria, Subway.
Subway?
Subway. So the owner has been in the hospital and is still in the hospital. So, I did speak to her daughter. So I think that's why that ended up the way it did. Dollar Tree. And then the 4 restaurants that are not open right now is Doc's Tavern at Edgewood, Nora's, Brass Rail, and Walk on Water.
Walk on Water's open and Brass Rail is open.
Yeah, Brass Rail's doing Sunday brunches, I think.
Big ones.
Yeah. So Tammy, you'll go in there with your cease and desist and a table of fines that they're gonna have to pay. Of course, they can appeal, I guess, to us. Are you okay with that, Sue?
Wasn't there something like does Dollar Tree have to pay? Does Dollar Tree have to get a license? Like remember
Yes.
Tractor Supply had to get a license, but they really don't because it's under.
Dollar Tree has perishable goods now.
Okay, they have perishables. Okay.
Yeah.
Okay.
That's the
Jean,
difference.
anything?
No, again, the discussion on the restaurants, the payments, that can be put off, and it may be a good idea to get another perspective from whoever our future board
Okay.
member is.
That's fine. I'll leave it up to you two to hash it out then. That's fine with me.
Us
Well,
two and the new one.
Pardon?
that was the 3 of us. And Jean, thanks for doing all that.
Thank you, Jane.
Well, that's the only way I could come up with an educated decision is by researching data. And without that,
Okay.
it's, and to me, when I saw the money amounts, it was like it's a drop in a bucket compared to the town's budget.
Well, we might get half of it back in the fines we're gonna levy here, and collect.
There is
Sorry.
one more thing I would like to mention, thanks to Tammy and all your hard work. I did go by the church and noticed that the capacity was in the parking area down to half. Thank you.
Kate, you have anything you want to add and thank you for all your work too. by the
No,
way.
sir. Thank you. I'm all set.
Okay,
Thank you for
Joe?
your support.
Hey, remember, Kate brought up when we were addressing we call it the church, that, Tammy, you were gonna contact the other churches in town just to make sure that you're complying. Remember that was weeks ago?
I think I've spoken to all but one church.
All right, okay.
Pretty sure. I have to look at my list because some of them, the names, I've got the pastor's names in my head, but not the.
Isn't that gonna be moot with this new order with going to the next level? Pretty much.
Pretty much nobody's congregation is over 50% of their building capacity.
Okay,
Yeah, but they're getting letters anyway.
okay, it's fine.
Today, tomorrow, the letter will go out. Well, now it's almost every week. Poor Jess has to do the letters for me every time something changes, but we send it out to everybody. Everybody gets the
Thank you,
newest
Jessica.
version of the rules.
Okay,
Doug, anything?
we have a question.
Yes,
Our
sir.
new secretary, her name is Karen, is that her name?
Yes.
Now, does she do any, work for you?
Yes,
And-
she does most of, but pretty much all the septic work, and that paperwork and our pay stubs or POs and all that stuff. And she certainly manages many health department related phone calls a day.
Okay,
Similar to what Melissa did.
all right.
Yep. She supports me. She helps me connect like people where I can't find a correct address of people that have tested COVID positive. So I utilize her quite a bit too.
All right, good.
Very
I
helpful.
talked to her about coming to the next one, but I have to make sure that I have it with, I get it with Kyle that, so if she's going to come, we're going to make up the hour somewhere else.
All right, see what it's like. That sounds,
Janine, you have anything?
No, I'm all set.
Doug, Joe? Dennis, anything you'd like to ask us?
No, I'm all set.
Peter, I have one thing. Peter,
Yes.
go ahead. Do you have anything?
No, I'm all set.
So, what's this happen? So the Woodland's open and Powder Mill's open, is that correct?
All schools
everybody's
are
open.
open.
And all 3 schools are open.
Yep.
So, but if you're remote, you're gonna stay remote for the rest of the year if you signed up for that?
Not
Not gonna
necessarily. They have hybrid cohorts. There's cohort A and cohort B. Cohort A goes Monday and Tuesday. Cohort B goes Thursday and Friday. Then they have a half a day on Wednesday. Unless there's a Monday holiday, then it's a full day on a Wednesday. And then they have some hybrid 5-day students, and that includes SPED. You want to bus these kids around Southwick, let me tell you, it's a logistical nightmare trying to figure out what kid's going to what school when.
So is there gonna be any possibility that I think they're trying to go to 3 feet between desks, is that right? That's what I heard somewhere. Is it gonna be
I haven't
possible?
heard that yet.
Okay, is it
I'll
gonna
ask
be
tomorrow's
possible that
meeting.
all the schools are gonna open by the end of the year if the numbers keep going down? Anybody think yes, no?
Well, I think some of the parents will keep their students hybrid or in-home regardless, because they don't want their children exposed. So it depends on whether the school offers, a continuation of in-home learning, or whether it's going to be mandated that all of the students go back to an in-classroom learning.
Well, I'm glad I'm not on that committee.
And there's been no transmission in the schools.
And I just
Sorry, Kate.
transport them, so.
didn't Biden say after his first 100 days, they'd be back at school full time?
Biden also said that after his first 100 days, we'd all be vaccinated.
Okay, he said he'll have 100 million shots and he's
Yeah.
gonna make it, so let's skip the
any-
politics.
Any schedule for our budget hearing, Tammy?
Yes, yes, they did come out.
Yes, it's March 20th. I thought I sent the email out, but maybe it didn't go. It's March 20th at 9:15.
And it's a Zoom meeting? Okay,
Okay,
you'll send us all the link then.
If I'm
Yeah,
not,
I only have I have to scan it in. I wonder,
That's fine.
does anybody have like, is it up on
I have it.
actual link?
What's that?
Is there an actual document that might have the link in it that would just go straight to it? Because I just have a.
They didn't post it yet. I just
Oh,
set the
okay.
Zoom meetings today. So I
Okay,
just sent them
so-
to Robin this afternoon.
Okay, you have
Oh.
a meeting next Thursday.
Wait a minute, wait a
Catch
minute.
up. Sorry.
Jessica, thank you for the copy of the budget.
Yes.
Oh, you're welcome.
They come out, what, every month?
I think so.
Yeah, so could you
Yeah.
just send them out every month when you get them, please?
Yep, definitely.
Thank you.
Are we
No
all
problem.
set then for tonight?
I am. I'd like to make a motion to adjourn at 7:06 PM, and I'm going to watch the Bruins hopefully win.
We're gonna meet next
Yes.
Next
James, yes.
Thursday.
coming
I'll be
Thursday.
watching too.
We're gonna catch up, get back on schedule. We'll meet
This
next
Thursday.
Thursday.
Yes, that's March 4th.
Okay.
All right.
Okay?
Second.
Oh.
Yes,
Uh,
yes,